好，我是沈玲，欢迎收看这一期的《天下纵横谈》。结核病 TB 是全世界最主要的传染病杀手之一，它同时具有传染还有致命性。而在美国，竟然有多达1300万人，他们是潜伏性的结核感染者。如果没有及时的展开治疗的话，5%到10%的潜伏性结核感染者将会发展为活动性的结核病。然而，时至今日为止，结核病已经不再是问题的观念仍然是存在的。在今天的天下纵横谈当中，我们非常荣幸邀请到了 Dr. Higashi， 他是 TB Control Program 的，从 Los Angeles County Department of Public Health 而来的，要跟我们一起讨论一下，到底这个结核病是什么，到底有没有方法可以治疗。Hi, Dr. Higashi.
Hello.
Hi, welcome. I would like to know, first question, the very important one. What do you consider as active TB and latent TB infection? Is that considered as a inactive TB?
Yeah, it's a great question. Tuberculosis is an ancient disease, and before COVID was the #1 infectious disease killer in the world. We know, I think now after COVID, we know what an airborne disease is, the disease that you get from breathing in infected air particles. So the difference between latent TB and active TB is that when somebody is exposed to those infected particles and they breathe them in, the first thing that happens is they might get latent TB infection. So that's a small amount of bacteria that goes into your body, and your body gets under control with an immune system, a normal immune system.
Uh-huh.
In that form of the infection, the person is not contagious. The tuberculosis is not causing an immediate problem. And for some people, they live with this TB in their bodies for the rest of their lives. In about 5% or 10% of people, those bacteria start to divide and multiply because the immune system cannot control it. And in that form, that's the active form of TB disease. And that's the deadly form. So in the United States, every person who gets the active form of TB disease, about 10% of the time, those people end up dying with their TB. So even in today's United States, in our healthcare system, it is still a pretty deadly disease. So in that form, most of the time, TB can go to any organ in the body, but a lot of the time it goes to the lungs, and that's when people cough into the air, or they might have it in their throat, and if they sing, that's how those infectious particles get released, and that's how TB is spread.
Okay, noted. So through your explanation, I understand that there's a possibility a person can actually be inactive on TB with symptoms showing or without symptoms showing.
The definition of somebody with inactive TB or latent TB is that they have no symptoms and that they have nothing in their chest X-ray to show that there's any presence of TB in their body.
If that's the case, first, that's asymptomatic, and second, if it doesn't show in the X-ray of the lung, then how should you be tested?
Very good question. So in the case of tuberculosis, the best way to understand whether you have TB infection is to get a blood test. And there are different tests, but the blood test is the best test. Generally, the blood test is the best test. And in particularly, it's the best test if you've had the TB vaccine. And that is because with other tests, and I think some people have had the skin test, if you've had the vaccine, it's confusing because you can just be positive just because of the vaccine. But when you get the blood test, if it's positive, then you know that you have at least the latent TB infection.
Noted. Okay, Dr. Higashi, I got a question. Because for every immigrant, there's a lot of immigrants who come to the United States, they need to be tested to see if they're TB active or not. I understand it was like on your skin that inject something in here, And then
Mhm.
they'll see if that's red or not red, or see how puff it goes to see whether you're active or inactive. Is that correct?
So you're talking about the other test that I was referring to, which is the tuberculin skin test. And
Okay.
that's where there are these proteins that are injected in a little bubble on the top of your arm.
Mhm.
And if it becomes swollen and red up to a certain amount of that would be a positive result. That is one of the ways that people can be tested for TB.
Mhm.
And that is the test that if you have the vaccine, and most Asians who were born overseas get that vaccine. And so
Mhm.
that leads to a myth, which is every positive TB test is related to the vaccine. That isn't the case. If you get the blood test and it's positive, then you have at least TB infection. You need to get a chest X-ray so you understand what the next steps are as far as preventing treatment.
Okay, since this is not listed within our annual health checkups, should we actually call our family doctor and say, I would like to get a TB test?
Well, right now the CDC is running a latent TB infection campaign. That's
Mm-hmm.
very exciting.
Yeah.
And it's called the Think, Test, Treat campaign. And there are some physicians who are actively actually asking their patients, and other care providers asking their patients about risk factors for TB. So that's the Think part of the campaign. What are my
Okay.
risk factors?
Yeah, what
And
are
those
the
risk
risk factors?
what are the risk factors exactly? And those risk factors would be, did I spend time in a country that has high rates of TB? And that could mean that you were born in that country, or that could just mean that you spend a lot of time in that country. Over a month is sort of a benchmark period of
Mm-hmm.
time. And the areas of the world, because TB is a global disease, that we worry about having high rates are Asia and Africa, Eastern Europe, and a little lower rates in Latin America, Central America, South America. So those are the hotspots for TB. And so if you're born in those countries, or you spend time and you travel a good deal to those countries, it is a good idea to get tested for TB. The
Mm-hmm.
other risk factors, as you know, with COVID, the concept of contact tracing, the health department goes and does investigations, and you, if you've been identified as a contact, will be notified that you had an exposure. So those people also need to be tested.
Mm-hmm.
And the other group of people are people who have risk factors for being vulnerable to TB. And so they may not be born overseas, but they
Mm-hmm.
may be on medications that really suppress the immune system. And so there's a group of folks, people with HIV,
Mm-hmm.
people who have had organ transplants, for example, and other medications. So that's the
Sure.
think part of the think, test, and treat.
Okay, yeah. So, for people who understand the risk factors, and if you can understand how to actually get tested.
There is an opportunity. That means that if you go and you get tested and
Mm-hmm.
you have latent TB infection, for you to get preventive treatment. And what's really great is that we have much better treatments than we did even about 10 years ago, that are shorter and better tolerated and can really do the preventive treatment before the TB activates and becomes a problem. So that would be, along with the CDC's campaign, the Think,
Mm-hmm.
Test, Treat, the best way to really protect ourselves. So one of the important things to know is, even if you do get the active form of TB disease, it is treatable and curable. And it is, and there are clinics and health departments in the United States and in other countries, and every day people are receiving treatment and being cured. So even if you do end up with active TB disease, it is treatable, curable. If you have symptoms of cough, fever, or night sweats for over 3 weeks, go see your doctor and get evaluated.
今天非常谢谢 Dr. Higashi 跟我们提到了，其实重视检查还有治疗结核病是非常重要的。同时呢，美国疾病控制及预防中心，也就是 CDC， 现在也在做一个全国性的宣导活动，就是为了让你了解要开始重视检查还有治疗结核病。这个重视检查还有治疗结核病的宣导活动呢，就是为了要提高你对结核病它的严重甚至有可能致命这样的一个了解的行为，一起来改变人们还有我们的治世思想，最好要提早预防还有治疗这个结核病哦。所以请你与你的医生，甚至是你的家人们，或者是你的社区们一起来了解所谓的结核病，让我们一起了解到这种传染病疾病可以侵害到的第一步，当然啦，做好防御措施，由你开始哦。
5 things to know about tuberculosis, or TB. 1. Anyone can get TB. TB bacteria are spread through the air when a person with TB disease coughs, speaks, or sings. 2. TB is not a disease of the past. CDC estimates up to 13 million people in the United States have latent TB infection. People with latent TB infection do not have symptoms and cannot spread TB bacteria to others. However, without treatment, 5 to 10% of people with latent TB infection will develop TB disease at some point in their lives. For some people, the risk is much higher. 3. TB can happen anywhere. TB cases are found in all 50 states. 4. Treating latent TB infection is effective and can prevent the development of TB disease. 5. It's important. If you are at high risk for TB infection, you should get tested and treated if you have it. Together, we can end TB in the United States. Learn more about tuberculosis by visiting www.cdc.gov/TB.